Hi, this is Daniel DiTuro. Are you frustrated with the U.S. healthcare system? In this video series, I'll share information about medical care, prescription drugs, dental, eye, and hearing care, and healthcare insurance. This video looks at the most expensive healthcare money can buy, Wealthcare's accomplishments, how HMOs manage corporate profits, not healthcare costs, and the not-so-free market healthcare system. Part 2 looks at fee-for-service to practice medicine, the high cost of conservative healthcare, the NP or PA will see you now, and U.S. Wealthcare versus universal healthcare. The United States leads the world in many areas, like consumer debt, legal and healthcare costs. The U.S. spends more on healthcare than any other country in the world. The $4 trillion annual cost averages about $12,000 per person. By comparison, many developed countries providing universal healthcare average about $6,000 per person. Although the U.S. spends $4 trillion on healthcare, millions of Americans have no health insurance and cannot afford the cost of healthcare. Many insured and uninsured Americans are one serious illness away from bankruptcy. An emergency room visit can cost over $10,000. In 2008, my mother fell and I took her to the nearest hospital emergency. There was no IV or heart monitor. She was x-rayed and occupied an ER bed about 5 hours. The cost for x-rays, evaluation, and 5 hours of ER observation came to $8,720. Her insurance reduced the cost to $1,831, including her copay. Today, the cost is even higher, and most uninsured Americans cannot afford it. How would you like being billed over $100,000 for a comprehensive, high-complexity emergency room visit? If you qualify and can pay cash, the cost is only $2,300 to $4,700. How is that possible? The hospital claims a loss on their income tax return. With the U.S. spending more on health care than any other nation on earth, one would think Americans would be the healthiest people on the planet. Out of 11 high-income countries, the U.S. ranks number 1 in cost and number 11 in the quality of health care. While politicians talk about the high cost of health care, most oppose changing the U.S. welfare system, defending the accomplishments of free market health care. For example, the U.S. welfare system has the third highest number of millionaires and billionaires following finance and technology. U.S. life expectancy is ranked about 40th worldwide, providing millions of new patients annually. The U.S. infant mortality rate is ranked higher than Canada and Europe. The U.S. has more obese and diabetic adults than any other developed country. The U.S. has the highest suicide rate of any developed country, supporting thousands of good-paying healthcare jobs. Many senior Americans take 6 or more prescription drugs daily, boosting pharmaceutical profits and stock prices. The number of overweight and obese Americans has increased from 30% to 70% of the adult population. Overweight and obese children become overweight and obese adults, spending billions of dollars on health care. Politicians also claimed the Health Maintenance Organization Act of 1973 would significantly reduce the high cost of health care. It created health maintenance organizations, HMO, to manage patient care and prevent rather than treat diseases. Instead of reducing healthcare costs, the result is corporate medicine and micromanagement by faceless executives accountable to investors. Instead of a big government bureaucracy, the U.S. has big corporate bureaucracy. Before micromanaged Wealthcare, a primary care physician ordered diagnostic imaging and referred the patient to a specialist if necessary. Wealthcare introduced another layer of bureaucracy by requiring a specialist to diagnose the problem. Also, to save money, you must use in-network doctors and facilities, and in some cases obtain pre-authorization for imaging, like CT scans and MRIs. Your primary care provider coordinates your care with insurance company oversight. Today, many low-risk procedures like cataract eye surgery and endoscopies are routinely done at outpatient clinics. Some outpatient facilities are owned by doctors who perform the procedure. While your doctor is in-network, his outpatient surgery center can be out-of-network. In that case, you can either go to another doctor or have the procedure done at an in-network facility that may cost more. Most Americans love and defend Wealthcare until their medical bills start piling up. Any attempt to regulate U.S. Wealthcare is vehemently opposed by conservative politicians and the Wealthcare industry. Conservative legislators insist only an unregulated, free market healthcare system will lower the cost of healthcare. They have made the same false argument for over 60 years. To prove free market healthcare lowers costs, conservative lawmakers use LASIK vision correction surgery as their example. The cost of LASIK surgery has decreased over the years, but so has the demand. Unlike cataract surgery, LASIK vision correction surgery is classified as cosmetic and is not covered by most insurance plans. Patients who do not need LASIK surgery for serious vision loss must pay the entire cost. Like most cosmetic procedures not covered by health insurance, LASIK surgeons must compete for patients. And competition usually reduces cost. It is a simple economic principle of supply and demand, but there is one major difference with Wealthcare. When you shop for clothes, you know the cost before you buy it. When you shop for food, you know the cost before you buy it. Would you buy groceries from a store that does not disclose their prices until checkout? Unlike elective cosmetic surgery procedures paid in full by the patient, most healthcare costs are a closely guarded secret until you get the bill. How can healthcare costs decline when they are unregulated and not disclosed until checkout? State and federal politicians receive millions of dollars in campaign contributions by the Wealthcare industry to defend Wealthcare. Please leave a comment if you have any questions about this video. Thank you for watching.